Let's talk about baby wearing. Now, a couple of people have asked me what are my favorite wraps, what are my favorite carriers, but I think the people to ask and the website to look into is this one here. And I'm gonna go into a little bit more detail in terms of how to baby wear. So I'm sure you guys have heard the acronym TICS. T is for keep them nice and tight against your body. I is for keeping them in view. C is close enough to kiss on top of the head. Making sure that their chin is off of their chest, especially when they're newborns. And of course, to support their back, which is the letter S. Now, the thing that they don't really talk about in this acronym is hip dysplasia, how to avoid the hip dysplasia, especially when you're using the baby carriers, and also with swaddling. But right now, I'm just going to talk about baby wearing and the two baby carriers that I usually utilize with both my daughter and my son. Now, you're probably wondering, why are we making such a big deal in terms of hip dysplasia? Let me go ahead and tell you a couple of things that I actually learned through research. So there was a study done in Norway where they had young adults who required hip joint replacement because of a hip dysplasia. And guess what? 90% of these young adults, unfortunately, when they were children and when they were infants, a lot of these little ones were not diagnosed in infancy. So this is why it's so important to know how to baby wear. Again, I'm a pediatric occupational therapist, and there are a ton of wonderful experts out there that know more in detail and specifics in terms of baby wearing, in terms of a female body and also children, and how to position them properly. But I'm only going to tell you in terms of the child and the positioning, and also what I use and what I do with my own devices. So please do your own research and make sure that with your own body and your own anatomy, if these type of carriers better suit you and your child as well too. Now, babies that are mostly at risk for hip dysplasia, and in general, even premature babies who are born breeched or were in breech position throughout the entire pregnancy, who were very large babies as well. A history of hip dysplasia in terms of within the family. Now, per the website of the International Hip Dysplasia Institute, females are a little bit more at risk, and same thing with prolonged labor. Hip dysplasia is mostly at high risk between 0 to 6 months, so definitely take that into account. After 6 months, typically they're a little bit less at risk, but they normally do mention in this particular website that it's very important to keep them inward facing up to the age of 1 year old, just for a better healthy hip development. Now, let's check this out. This is the Ergo Baby, the Omni 360. You can tell that this is the M position that we'd like the hips to be in. And it's great with the Ergo Baby because you could actually open these up, and you could also open the top up for head support or no head support when they're newborns. And this is pretty good for rain. I've used this myself when we go on hikes. Now, this is the boba wrap. So I'm wrapping it around my body. I make sure that the wrap is right smack in the middle, and I'm crossing it right behind my back. And I'm making sure that it's not jumbled up at the top of the shoulders, that it's nice and flat and even. You can tell that it's not really folded at all whatsoever in the very back. Now I grab these two pieces and I put them inside. And again, I make sure that both pieces are not folded and are as flat as possible and as tight as possible. I cross them over and I cross it again in my back. And then I go ahead and tie it up on the side. And that's pretty much it with the boba wrap. Now let me show you how I put my baby in. Now you're gonna notice right away that we put the baby off to the side, put one leg in, and make sure to put the other leg in. And this is where I struggled a little bit, so just make sure to double check and see that the bottom is covering the baby's bottom, so you can tell that I'm really trying to stretch it out on her bottom to really have that support from both sides. So make sure to do it in front of a mirror, and then you should make sure that both of their arms are up near their chest and not straight on the sides of their body. And then here you have the extra cloth on the bottom that I put over, and you're able to stretch it up and utilize this too for newborns for better head support. Overall, this is what works for me and for my little one. Ask me any questions if you have in terms of child development.